Hello, my name's Leanne McGlynn, and I'm here with McGlinnInstituteNeonatal. In this module, we will discuss the use of the Zoll Defibrillator for defibrillating a neonate. Remember, there are only two rhythms that you defibrillate: V-fib, as seen on the top, and pulseless V-tach, as seen on the bottom. Remember, if the patient has a pulse, defibrillation is not the treatment of choice. In order to defibrillate a neonate, you'll need to roll your neonatal crash cart to the bedside with the defibrillator, quick combo pads used for an infant, and all the meds and supplies that would be found on a neonatal crash cart. At the same time, you'll need to provide cardiopulmonary monitoring. The first thing you'll need to do, once your defibrillator arrives at the bedside, is apply your quick combo pads. You'll need to apply them in an anterior, posterior method, or front and back, as seen here. The first step will be to peel and place it on the baby's back by rolling the baby to the side and applying it firmly to the baby's back. Then simply roll the baby backwards. Now, you'll apply the front pad by peeling, applying it firmly to the baby's chest, as seen here. Now, you're ready to connect the pads to the defibrillator via the quick combo connector. You simply connect as seen here. Now, it's time to turn on your defibrillator. Once you've placed your quick combo pads on your patient for the purpose of defibrillation, it's time to turn your defibrillator on. With the Zoll, you do this by simply turning it to monitor. You'll know it's on and ready to use when you can see the rhythm as shown here. Now, in order to defibrillate with this particular defibrillator, you'll need to turn it to D-fib, as seen in red on this central dial. Keep in mind, with neonatal patients, there are only two rhythms we defibrillate. They are V-fib and pulseless V-tach. At this point, it is time to select our energy. Now, with defibrillation in neonates, we start with 2 joules per kilo. We go up by 2 joules per kilo to a max of 10 joules per kilo. Now, this particular patient is 3 kilos. So we are going to start at 6 joules. We're going to do that by choosing Energy Select and tapping it up until we reach 6 joules. And you can see right here it says defib, 6 joules selected. Next, we're going to clear the patient and the area and the bed. We're going to charge our defibrillator by hitting the charge button. We can now again make sure we're clear and hit the shock button to apply defibrillation. Next, we can now choose to go up to 4 joules per kilo. And in a 3 kilo patient, that would be 12 joules. So in order to do that, to defibrillate at 12 joules, which is 4 joules per kilo, we would hit our Energy Select until we reach what we wanted was 12 joules. But on this and many defibrillators, once it reaches 10, it goes to 15. So most cardiologists would say, choose your highest joules. So in this case, we'll choose 15 joules. We'll clear the area of the patient and the bed again. We'll charge. When it says defib ready, we can now make sure everything's clear and hit the shock button. Remember, you can resume CPR. At this point, you can begin drugs, and your first drug for any pulseless rhythm would be epinephrine. You would then alternate your drugs between epinephrine and an antiarrhythmic. You would also alternate between drug, shock. And this is how you utilize a Zoll defibrillator for defibrillation in neonates. So now we've discussed the 2 rhythms that you defibrillate in a neonate, the equipment and supplies needed, as well as how to use the Zoll defibrillator for defibrillation in a neonate. Now it's your turn. Let us know how this video helped you in your actual practice. Looking for an NRP, procedural skills, or simulation-based training course? McGlynn Institute Neonatal has you covered. Give us a call or text at 704-728-4961 or email Dr. McGlynn at drmcglynn@mcglinninstitute.com. Look forward to hearing from you soon.